All right, we're going to be looking at the anterior muscles on mini man or little man here. And there's a lot going on here. We are not going to be covering the forearm muscles on this model because they're very miniature here and they're best seen on the larger arm and forearm model. We will start here up at the top and let's look at some head and neck muscles that are visible for you. So if we start at the top, you have a muscle that covers the forehead. This can be called occipitofrontalis. It actually extends over the skull and goes to the back of the head. This muscle can also be called epicranius. If we move inferior, there's a circular muscle around the eye. This is called orbicularis oculi. And then going lateral above the ears here, there's a rather large muscle, and this is called temporalis. Temporalis. Now we can go, let's look at the nose, just lateral to the nose. There is a small muscle that goes mostly superior, inferior. That is levator labii superioris. So it's just on the side of the nose, and it goes up and down, superior, inferior. There's a circular muscle around the mouth that is called orbicularis oris. And there's a smiling muscle that goes from the corner of the mouth up to the cheekbone. That is zygomaticus major. If we look in the cheek area and you go really deep into this hollow area of the cheek, there's a muscle that is used for whistling, and that is called buccinator. We also have a very powerful muscle. This is for chewing. This is called masseter. It goes from the angle of the mandible up toward the cheekbone area. That is called masseter. All right, let's head into the neck area. There's a large neck muscle that connects the mastoid process of the temporal bone, just behind the ear, all the way down to the clavicle and sternum. This is called sternocleidomastoid. Very large neck muscle. You also have to know sternohyoid, which extends from the hyoid bone down toward the sternum. Okay. You can see trapezius peeking out in the neck area. This is a posterior neck muscle, more in the shoulder and back area, but you can see it peeking out here. So that's trapezius. Let's move down to the torso area, anterior torso, and we'll check out the largest chest muscle here. This is called pectoralis major. Pectoralis major. And as you look at the model's right side, so this is your left side when you're looking at it, but it's the model's right side, you're seeing the most superficial muscles. On the model's left side, they've cut away some of the superficial tissue so that you can see some of the deeper muscles. So over here on the model's right side, you have pectoralis major, but if you take that away, there is another muscle underneath it, and that is called pectoralis minor. Just lateral to that, there are some muscles that cover the ribs, and these are called serratus anterior. Serratus anterior is the boxer's muscle. Then let's head into the abdominal muscles. You have your 6-pack or 8-pack muscles. These are more medial, and what people often call fibers, but these are fascicles of muscle. These run up and down. Okay, these are called rectus abdominis. Rectus means straight up and down, erect, and so these are the erect abdominal muscles. If we go lateral to those, let's go over to the model's right side. The most superficial abdominal muscle on the lateral portion of the abdomen is called external oblique. Oblique means diagonal, so the fascicles are at a diagonal arrangement, but this is the most external, so it's called external oblique. On the model's left side over here, the external obliques have been removed, and you can see the next deep layer, and notice these are going in the opposite direction of external oblique. So external oblique on this side of the model would be running in this direction, and internal oblique counters that, runs in the opposite direction. This is internal oblique. They are still diagonal, but these are deeper. They're internal oblique. There is a fourth abdominal muscle that you cannot see on this surface of the model. So what I've done is I've removed this piece, this anterior torso portion, from another model, and I'm going to show you the inside of it. And this is the same structure flipped. And there's one more abdominal muscle that runs sideways. This is called transversus abdominis. It is the deepest of the abdominal muscles, transversus abdominis. All right, let's look at some arm muscles quickly, and then we'll head on down into the lower regions here. We need to hit the shoulder muscle. The large shoulder muscle is called deltoid. That's an important muscle. And then the anterior arm muscle, most people call these their guns. This is biceps brachii, or some people call them their guns. I'm going to go over here to this side. You can see in the axillary area, this is a really good view of coracobrachialis. And then over here on the model's right side, you have biceps brachii, and just deep to that is brachialis. Brachialis. The posterior portion of the arm, you can see it best over here, is triceps brachii. Triceps brachii. You can also see on this model teres major. Teres major. I need to also show you the muscles that are in between the ribs. These are called intercostal muscles, intercostals. There are two layers to them. There's the external intercostal and the internal intercostal. They're named according to how close they are to the outside of the body, or if they're deeper and closer to the inside of the body. So external intercostal is called external because it's closer to the outside of the body. And these are also a little bit more lateral. So you're going to see it right here, right here, right here. You can see these all the way down here. Internal intercostal is deeper. They do run in an opposite diagonal fashion. Internal intercostal is also more medial. So this is internal intercostal here, 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 and you can also see it poking in between the ribs as you go down. So those internal intercostal, more medial. External intercostal is also more lateral. Okay. Let's head on down to the thigh region. The thigh region is once again the space between the hip and the knee. If you go inferior to the knee, you are getting into the leg. Okay, so let's focus on the thigh for a bit, and let's just point out the different ones that you can see from this angle. So starting from the hip region and moving down in a medial direction, this is the longest muscle in the body. This is called sartorius. And then just lateral to that, where it connects up toward the hip, this is tensor fasciae lati. It's not very long. It eventually turns into the iliotibial band. Okay, you can see the inner thigh muscle pretty well from this aspect. That inner thigh muscle is called gracilis. Gracilis. Then you have your quadriceps muscles in the thigh. There are 3 that are visible from this aspect, and so the central one is called rectus femoris. Rectus femoris. Then you count 1 over laterally, that is vastus lateralis, and you can count 1 over medially, and that is vastus medialis. Vastus intermedius is underneath rectus femoris. Let's see how easily I can take this apart for you to see. So underneath rectus femoris, you're going to see what looks like a white stripe. That's actually very thick connective tissue that's covering a muscle. And the muscle that's in there is vastus intermedius. So the 4 quadriceps consist of rectus femoris, vastus medialis, vastus lateralis, and deep to the rectus femoris is vastus intermedius. All right, we are making progress here. We are almost done. We're going to go down below the knee. Once again, this is called the leg. And you've got your the largest and the weight-bearing leg bone, the tibia. And so just superficial to that is the muscle called tibialis anterior. You can also see going lateral, the most lateral leg muscle that you need to know, fibularis longus. And if we go medial, you can see an important calf muscle peeking out, the most superficial calf muscle, which is called gastrocnemius. And you can also see soleus, just deep to that, peeking out a very small amount as well. Chase?
Oh, got one?
Yeah. I think I got him.
Sorry, I'm trying to get your evaluation forms and Stefan's evaluation forms.
Oh no, it's okay, it's okay. I think I got him. I wound up getting down here and then I had forgotten the intercostals, but I still covered them. I mean,